Hello, my name is Lee Martin. I'm a paramedic firefighter with the Bernalillo County Fire Department. Today in this video I'm going to be going over the LifePack 15, its basic button functions, and how to properly utilize it on a scene. Okay, so this video is going to be structured mainly for someone who has no experience with the LifePack 15. I'll try to keep you engaged if you've already had exposure to this device, and maybe you can find some new functions that you didn't know existed, or just some different ways to do things to make your workflow a little more efficient on a scene. Okay, so we're going to start out with this from the very beginning. So how do we turn this device on and off? Here at the very top you see the on button. You can go ahead and press that. You can get a green light before the screen comes on. It's going to do a self-test and it's going to initialize it. Now, once you turn this device on, it's going to start tracking all of the data that it's collecting. Right now, obviously, it's not hooked up to a patient, so it's not collecting any data. But as soon as you put something like the pulse ox on, do a blood pressure with the NIBP, or place them on the cardiac monitor or the paddles, it's going to start tracking it and logging it as one specific patient. Now, if I were to turn this device off, I'm going to go ahead and press the on button again, hold it until the device turns off. This is going to terminate that unique patient within the tracking software. Once I turn it back on, we're going to begin a new patient. It's going to start tracking everything else with a different unique number in the archives. So let's turn this on, let's explore some of these buttons. Alright, our LifePack 15 is on. It's ready for us to hook it up to a patient and do whatever type of diagnostic procedures we want to do with it. Let's start looking at the buttons on this right side of the monitor's screen. At the very top you see a CPR button. This is an AED function, so paramedics are not going to be using this button, but for ILS and BLS providers, this functions much like the AED that we carry on engines or that are found at different public facilities. You'll hear when I turn this button on, you're going to see a yellow light come on next to the CPR and a metronome is going to start. You can see down here that our LifePacks default to no airway, 100 compressions. So this is not going to prompt you to give any type of ventilations during CPR. If we turn that off, our metronome stops, and this is also going to be logged in our code summary when CPR was begun. That's a good thing for whoever's doing the chart. It gives you a good timestamp for when CPR was started, things of that nature when you're doing your narrative. Okay, this is another AED type function of the LifePack 15. This is the Analyze button. So if you have CPR in progress, just like the AEDs that all the CPR certified people have been trained on, it'll prompt you to analyze the rhythm after 2 minutes. You would press this button to analyze the rhythm.
Connect electrodes.
It's giving us a fault message because the electrodes aren't connected to a person and it's not detecting any cardiac rhythm, so to say. But it would analyze it if this was on a patient, and then it would instruct you whether to charge the device, to deliver defibrillation, or to continue
electrodes.
Or to continue CPR.
Connect electrodes.
Okay. So that is our CPR and Analyze buttons. Below that you'll see two smaller buttons, the lead and the size. Let's look at the lead. As you can see, when we turned on the LifePack 15, it defaults to paddles mode. Just below those, the energy selection and the battery indicators, you can see paddles ×1, and down here you can see CO. So that'll be monitoring end-tidal CO2 waveforms if we had the patient hooked up to the end-tidal CO2. If we want to change what we're looking at, you can press the lead and it gives you a whole bunch of options down here on what you want to see. These are all presets. So if we wanted to do 2-3 and AVF, is basically a good standard cardiac monitoring layout. If we didn't want capnography, you could select that with this speed dial, press the speed dial in, and it would select it. Now you can see that instead of it saying paddles here below the energy selection, it says 2, 3, AVF, and that used to be our CO monitoring. Now that's no longer CO, and we're looking at another view of the cardiac rhythm. You can do any one of these options down here in this drop down, or you can do it manually. I can use my speed dial, and as you can see, once I click the speed dial to the left or right, it selects or highlights a different portion of the monitor's layout. You can go up to heart rate. This is our SpO2 monitor. You can switch that to different parameters. So let's go over that. It defaults to SpO2, so that's going to be our oxygen saturation. You can also change it to SpCO. Now this would be carbon monoxide, something that we would look for in a patient who's been involved in a structure fire or where we have any type of concern for carbon monoxide poisoning. You use the same equipment. The SpO2 monitor is set up for SpO2 or carbon monoxide. Let me go back over there. You can change the sensitivity. Normal should be good for the BLS level provider, and the averaging times. 8 seconds as the default. I would leave it there. Now let's look at the heart rate. As you can see, it's not showing anything right now in these bottom two sections of the left side of the screen, but if I were to scroll over it, you could see CO, so we could be monitoring both at the same time. And it's also got NIBP. This will turn on if we cycle a blood pressure using the LifePack NIBP built in, and it will start tracking. What's important for the NIBP that I think a lot of people should start using is the intervals. If you have a patient with who might be critical, who might be sick, who you want to watch trend their blood pressures, you can click into that lower part of the screen and it'll give you these options. You can start an interval where you can have between 1 hour and 2 minutes of blood pressure intervals. This is really good because you can set this and forget it. Leave the blood pressure cuff on your patient, and every 2 minutes after I hit this start button, it's going to cycle another blood pressure, and you'll be able to see that in the archive mode and in the code summary later on after the call. Once I hit start, you can hear the compressor start going, and it's going to cycle this. Once this is done, the 2-minute timer will start, or whatever interval you have set on, as you can see there, and it will just continue to cycle. Okay, now let's go back over to the buttons. Here we have size. This is important for generally ALS providers would use this. If there's a lot of artifact that they're seeing and they're having a difficult time identifying a rhythm or seeing through that artifact for whatever reason, you can change the size of it. All this does is basically increase the gain on the detection device or the electrodes so that you can see more pronounced features of the cardiac rhythm. If it's a small P wave and you're having a difficult time seeing whether or not the rhythm is sinus through the artifact, that would be a good way to troubleshoot it. Turn it up to 2 or even 3 to see through that artifact. Alright, here's the sync button. The sync button is going to be for our paramedics. If we are going to sync cardiovert someone, you would have them placed on the monitor with the pads and also a 4-lead connected, and you would hit this sync button. Again, you can see a yellow light next to the button that indicates it's on. You would also see that hopefully the device is detecting all of the QRS complexes of the rhythm. That's going to be gone over in another video. And so that's the sync button. I touched on the NIBP button a little bit. If you don't want to set the interval, let's turn that off. It's as easy as that, just turn it off. If you just want to do it manually every time, you can place the patient on the blood pressure cuff and press this once, and it will go ahead and cycle the blood pressure. It's normal to see these numbers going up and down as it's getting the blood pressure, okay? Don't think that it's having a hard time. If it takes longer than, I would say, 30 to 45 seconds to get you a blood pressure, or if you hear the compressor time off or go higher, it might be having a hard time. You might consider removing some clothing or repositioning the cuff. Maybe you need to use the large cuff or the small cuff. Just general ways to troubleshoot having issues with getting an NIBP with the LifePack 15. It's generally a pretty reliable number in my experience though. Here's our alarms button. So all the LifePacks are set up default to alarm on certain things. It can alarm on cardiac rhythms that are problematic, like if it sees VFib, it can give you a VFib alarm. If it sees asystole with a patient on the monitor, it can give you an asystole alarm. Also, if you have someone on capnography, you'll often hear an alarm if it thinks it's detected an apnea. So if the patient stops breathing or if the cannula falls off and it's not getting a consistent waveform anymore, you might get an alarm that says an apnea alarm here on the bottom. It generates a tone to let you know that it's tripped an alarm, and this light will turn on. What you can do to silence that alarm is you can just press the silence and you can set the silence intervals for 2 minutes up to 15 minutes. If you don't want to hear that alarm anymore, you see here VFib or VTAC alarm is defaulted to off, and then you can quick set it. So once I hit the quick set, that's going to stop that sets your parameters for all of the alarms, and then you can silence it for however long if it trips. Press the home button to get away from the alarms. Okay, let's go over, before we get to the options and the event button, let's look at the right side of this control panel here. Here you can see the energy select, charge, and shock buttons here. These go in conjunction with CPR for BLS and ILS providers. If it says it needs to shock, it should auto detect that and begin a charge. If not, you can start the charge button right here, and it will charge to whatever energy is selected in the top right of the screen. If you're ALS provider, you can obviously change the energy that you want to administer to the patient with these up and down switches here, and then you can select the charge button again. You'll see a bar begin to fill as the device starts to charge, and this is how you'll deliver your charge or defibrillation or sync cardioversion. This box right here is all of the transcutaneous pacing buttons that are used by ALS providers. Again, you're going to want to, you can turn this on. Unfortunately, since this isn't connected to a patient and we don't have a cardiac rhythm, it's going to prompt me to connect electrodes. In another video, we're going to set this up with a rhythm generator so that I can show you more in depth exactly how that looks when you actually have a patient on the monitor. You would turn the pacer on. This changes our rate up and down and the amount of current we're giving. Also, this is a handy button you can pause it to do any type of other rhythm checks, to see underlying rhythms, or do any type of other troubleshooting. Instead of having to reset your rate and current every time by turning it off, you can just pause it, and that'll keep your settings where they are for whenever you want to resume that transcutaneous pacing. Here we have a brightness screen, day and night. Most everybody just leaves it in the night mode. That's generally the easiest thing to see. Over here, let's go over the options button. Options has a lot of things that you can do. The most important of which is putting in patient demographics for things like 12 leads. That's very important for all of our tracking, especially if we're going to be transmitting a 12 lead. We want to have last name, first name, and date of birth attached to that 12 lead so the hospital knows whose it is and they can track it. So let's look at that. I click the speed dial in to select the patient. It starts with last name, so we'll put in, using the speed dial to select the proper letters. I'm going to say last name is going to be Doe. I'm going to select end. Scroll down to the first name and we'll put in John. Again, we can put end when we're done. Now this patient ID is where we're going to put in the date of birth, okay? So you can see that there are numbers all the way at the bottom. You scroll all the way down to them. You're going to put month, day, dash, year. End again. And those are the patient demographics. Down here for the rest of the 12 lead, you can put in that they're a 50-year-old male or female. And then you can hit the home button. Now your patient demos are in. When you're ready to do a 12 lead or you're instructed to do so, you can go ahead and press the 12 lead button here on the left side of the screen and it should run a 12 lead. Down here will let you know that it's capturing the 12 lead and then analyzing the 12 lead, then you'll get a printout. Okay, let's look at some more options. This is the archives option. We're not going to go into the archives on this one. As you can see, once I selected it, it says that this will end monitoring and close the patient record. So this is something generally done after the call is over. If you need to get another code summary or print out the vital signs, that's where you would go. You can select pacing. Non-demand is the default with detection on, internal pacer detection. So that would look for anything like if someone has a pacemaker in place, it would be working in tandem with that. This is our print function. As you can see, we can print a number of things in a number of different formats. If you want to print an additional 12 lead so that the paramedic for Bernalillo County Fire Department has one, as well as give one to the Albuquerque Ambulance paramedic, you can go to the options screen, go to print, and you would print the report. Down here, it'll start to show you, once you shoot the initial 12 lead, it'll start to list off the 12 leads, all of them, and you can print out one individually or you can print them all out with the code summary. Or if I just want to print out the vital signs for my record keeping and my narrative writing later on, I can select that and I can select print, and you can see down here it'll print out all the vital signs that it captured since I've turned it on. Okay, let's keep exploring the options. Here you have date and time. This should be constantly tracked. I wouldn't touch this unless your administrator or your officer tells you to do that, because it should be accurate. You have user test. This is something you want to do every time you come in for your shift or for your cycle, is you want to run a user test and a load test. So every time I come in for my cycle, I make sure that the batteries are full and I do a user test. So I'll turn it on, I will go to the user test, I will select it with the speed dial, and as you can see at the bottom it says user test in progress. You're going to wait. Generally it takes anywhere between 20 to 30 seconds for it to do its entire diagnostic process, and then it will print out whether or not it is passed or failed, and then you can go from there. So as you can see, it printed out a timestamp, user test was passed. That means we're good to go in that department. Here you have the alarm volume. It defaults to maximum. Again, I wouldn't really mess with this unless your officer or supervisor asks you to do that. You have the alarm silence button that you can go ahead and utilize if those alarms are getting too overwhelming. Okay, and then we have this home screen that I've been touching. So this is the home screen button. Once I press this, it basically gets me back to whatever view that I have it set on. It's going to get me out of my options menu. It'll get me out of my leads. It just defaults you back to where you want to be. On the left side of the screen, you can see the 12 lead button. We touched on that. That just cycles the LifePack to capture a 12 lead. You have a transmit button down here. If you need to transmit a 12 lead for whatever reason, if it's a STEMI alert for instance, you would press this button. It brings up this transmit screen. You would select which 12 lead you want to do. So if you've shot multiple 12 leads, it will say 12 lead 1, 12 lead 2, 12 lead 3. It also corresponds to the 12 lead 1, 2, and 3 printout. So based on whoever has told you to do this, and they're going to choose which 12 lead to send to the receiving facility and transmit it off. So we're going to pretend like that vital signs says 12 lead number 1. We'll select that, and then you're going to want to select the site that you're sending it to. So as you can see here, we have Presbyterian Downtown, Loveless Heart, UNMH, Loveless Downtown, CodeStat or Test. So all these facilities here we can transmit to. So if we know that the patient uses the Presbyterian system and we're going to be transporting them to Presbyterian, obviously that's where we want to send it. We'll select it with our speed dial, and then we would click send. You're going to see down at the bottom again that it attempts to transmit. It's going to give you a 0 out of 100% transmission, and then once the transmission is complete, you will actually see a printout that tells you the transmission was successful or it failed. Code summary here. This is something that can be gotten to either using this button, or you can get to it through the options and the print function. Once you hit code summary, it's going to start printing all of the data off that we have gathered since the power on of the device. So I'm going to just stop that for now. And it will just continue printing until the code summary is complete if you don't stop it. And then on the bottom here, finally, this is the print function. So if you have someone on your cardiac monitor and you want to capture their 4-lead rhythm or their capnography waveform, something of that nature, you can go ahead and press this print button, and it's going to start printing out whatever is on the screen right now. So since I'm back in paddles mode, it's only going to be printing out this paddles mode with no capnography. And it's going to print until I press the print button again for it to stop. So if I want it to stop, if I feel like that's enough, I press the print button. You can see that there's a bit of a delay between me pressing it and the printing to stop. And that's how you can print out what you're seeing on the screen. If I want something different to print out, obviously I'm going to have to change my leads to 2, 3, and AVF if that's what I want to print out. There was a bit of a lag there because it prints a couple seconds back from what you're actually seeing real time. That way it's easier for us to capture dysrhythmias or something. You don't have to hit the print button right away, right when you see it. It kind of backlogs it a little bit. Okay, so that's the basic button functions for the LifePack 15. I hope this was useful to everybody, and I hope you gained a little bit extra knowledge or some tips and tricks that you might have seen that can be useful to you in the future and on your calls. Be safe. Thank you. Okay, let's also go over the event button here. Down here at the bottom is our last button, the event button. When we press this button, this is very pertinent in code situations or anything where you need a lot of timestamps, where you're going to have lengthy narratives, things of that nature, or you're doing a lot of procedures just in general. So, like I mentioned earlier, once I turn this LifePack 15 on, this is tracking everything that we're putting into it. It's compiling it as if it's one patient until I turn it off again. So if we're running a code or we're doing starting IVs, anything of that like that, giving medications, it's a good function, it's a good practice to have to put the events in. So as you can see, it gives you a lot of different options of what you can do. The first option being generic. So if you want to do pulse checks, or if you just want to remember off the top of your head that, okay, we're doing a pulse check right now, it's good to just use the generic event. To do that, you can see that if we're running a code, somebody gets IV access, whoever's on the monitor can chart that and it'll give you the IV access. Epinephrine every 10 minutes, you can put that into your code summary. So this is just a really handy feature that helps us not rely so much on memory or communication during a code situation. Oxygen, aspirins, you can see you can even put aspirin in. This has all of our drugs. So that's the event function on the LifePack 15 monitor. I encourage everybody to use it because once your code is done, and if you've put every event, every intervention that you've done into the LifePack 15 itself, when you print your code summary, it makes that narrative very, very easy to write, and you're not trying to rebuild the code. It's already built for you in your code summary. Hello, my name is Lee Martin. I'm a paramedic firefighter with the Bernalillo County Fire Department. In this video, we're going to be going over sync cardioversion. Okay, so we're going to talk about sync cardioversion with the LifePack 15 monitor here. Now, obviously, we're going to be doing sync cardioversion to patients with a perfusing pulse, but they're not perfusing adequately, they're symptomatic, and they have some type of dysrhythmia that can be corrected. So I'm going to hook my LifePack up to a rhythm generator. As well as a 4-lead. Okay, you can see our LifePack 15 defaults to paddles mode initially, but now that I have a 4-lead set up, it's swapped over to lead 2. So I'm going to go ahead and change that to 2-3 and AVF so we can see fully what's going on here. Alright, so this is a general view of what you would see with a patient with a normal sinus rhythm. Now, if we're going to go into a sync cardiovertible rhythm, here we have narrow complex tachycardia. Oops. Okay, so as you can see here, we've started a patient on the monitor. They're presenting with SVT. This is a rhythm that we can sync cardiovert. If they are hemodynamically unstable, it would be our first line. If they're symptomatic, it would be our second line after adenosine. So what we're going to do to sync cardiovert this rhythm is the first thing we're going to press is this sync button here. When I press this button, you can see that the light turns on and it's flashing every time it's capturing that QRS complex. Also, it's going to confirm that it's capturing because you'll see a little arrow forming right above the top of that R wave going across. So it's a good idea to print this for our documentation that we've captured it in preparation to sync cardioVert. It's going to default to printing as well prior to delivering the charge and afterwards as well, so it gets your pre and post sync cardioversion rhythms. So in order to sync cardioVert, again, we're starting with this sync button. It's very critical that you make sure that the device is actually sensing all of these QRS complexes, and then we're going to select our energy using the up and down energy select button. We're going to start at 100 joules, and then we are going to charge. As soon as the charge button is ready, you can see we're ready to deliver a shock. What you're going to do with this, let me dump that real quick. Once it's ready to shock, you're going to hold this button down as opposed to just normal defibrillation where you can just press it. You're going to hold the button down, and that way it's telling the LifePack 15 that yes, we are ready to deliver the shock. but the LifePack 15 itself is going to time that shock in order to do a sync cardioversion precisely where it needs to do it. Again, once that shock is delivered, it's going to give you a printout of the shock being delivered as well as the pre and post shock rhythms. So hopefully that does the trick to convert the patient and to increase their blood pressure and further treat them as appropriate afterwards. If not, if subsequent sync cardioversions are necessary, again we can increase our joule settings by increasing with the energy select to 200, and then you would go to 300, and then finally 360 as your maximum joules. Okay, and then we'll turn this sync off, and you can see the arrows on the top have gone away. The device is no longer syncing. That means if you were to do any type of sync cardioversion again, you would have to confirm once again that it has captured the QRS complexes. It's important to note that I have the 4 leads on the patient in addition to the pads. If you don't have the 4 lead and the pads on, it's not going to be able to see through the rhythm quite correctly, and you'll either get an error code or it won't be capturing the syncing. This video is going to be covering transcutaneous pacing. Okay, so you can see that I already have my monitor hooked up with the 4 lead on the rhythm generator, which is our stand-in for our patient. Also, the pads hooked up as well for pacing. You can see that I've already set up the our quote-unquote patient to be presenting with sinus bradycardia. We're going to go ahead and assume that this is hemodynamically unstable and that transcutaneous pacing is indicated in this sense, or in this instance rather. So here's how we do that. You can see right here, all 4 of these buttons right here, this is our pacing function for the LifePack 15. We're going to start pacing this patient again by having both the pads and the 4 lead connected to the patient. We're going to press the pacer button and it's going to immediately prompt us to put in the rate of what we want to start with. Generally 70 per minute is a good place to start, so I'm going to use my speed dial to select that, and then we're going to start with the current at about 30. So it's important to note that I did that with the speed dial, and if you see that if I use the speed dial to select my milliamps, it gives me increments of 5. If I use this current button up and down underneath the pacer function, I go up by 10. Okay, so you can do it either way. However you want to do it, either way you want to start with 30. Again, the rate is up here as well. You can change the rate by increments of 5 with the speed dial, or increments of 10 with the buttons. So let's start with 70 at 30 milliamps. Okay, so we see our pacer spikes. We see that the device, by indication of the arrows above the QRS complexes, that the device is capturing those as well and tracking them, but obviously we don't have electrical capture yet. So we're going to increase our current. I'm going to go ahead and opt to increase by 10. So I press the up once. I'm going to press the up again to 40. Still no electrical capture. 50. Still no electrical capture. 60. 70. 80. At 80 you can see that the rhythm is changed. Our pacer spikes are nicely placed right before these ventricular depolarizations. We have electrical capture. You would obviously want to confirm mechanical capture at a central pulse point, rather either the carotid or the femoral. If it coincides with that, you are successfully transcutaneous pacing your patient. You would want to cycle of blood pressure and to continue to treat the patient. Now then, if you want to pause this pacing to again analyze the underlying rhythm, whether or not there's been a change, if your patient presentation has changed at all, instead of turning off the pacer completely, we don't want to do that because we worked so hard to capture this rhythm. You can use this pause function right here. It's important to note that the pause function is you either hold it to have it on, and as soon as you let go, the pacer takes back over, okay? So I'm going to hold this and let's see what happens. You can see that the LifePack has started to print out the rhythm. That way it helps you see what the underlying rhythm is here. You can see that we're still in sinus bradycardia and the patient is deteriorating, so let's go ahead and resume pacing by just letting off the pause button. And as you can see, it picked it right back up. So that pretty much sums up the pacing function for the LifePack 15. It's a very easy procedure to do once you've identified that it is in fact indicated. Sometimes it can be kind of hard to get that initial electrical capture, but once you have it, again, it's important to just maintain that. As you can see though, it's a very easy process to turn the pacer on, select your rate by using either the rate button or the speed dial, and then your current by using the current button or the speed dial as well. Okay, I hope that this video was informative to you and you learned something. I look forward to hearing about your guys' successful transcutaneous pacing efforts in the field. Thank you.